Andrew Phillips, PhDA simulation model of the transmission and treatment response of HIV in sub-Saharan Africa predicts a cost-effective approach for treating the approximate 10% of HIV-infected patients who are resistant to the standard World Health Organization (WHO) recommended first-line regimen. Andrew Phillips, Ph.D., Institute for Global Health, University College London, London, UK, and colleagues indicate that this region of limited resources and more than 18 million people now on antiretroviral therapy (ART) confront an increasing prevalence of pretreatment resistance to the non-nucleoside reverse transcriptase inhibitor (NNRTI) component of first-line treatment regimens. Responses need to be guided not only by what is predicted to be the most effective option for averting daily disability-adjusted life years in the population but also by cost-effectiveness, Phillips and colleagues indicated. The options built into the HIV synthesis model to confront the resistance to NNRTIs, evidenced particularly with first-line efavirenz, Sustiva, Bristol-Myers Squibb, were based on using dolutegravir, Tiviki, VIIV Healthcare, which is the WHO-recommended alternative to efavirenz-centered regimens. The investigators analyzed outcomes from either testing for NNRTI resistance at treatment initiation and providing dolutegravir-based regimen if resistance is detected, or transitioning the recommended first-line ART to dolutegravir-based regimens, obviating need for testing NNRTI susceptibility. The investigators described the individual-based simulation model, developed to facilitate analysis of HIV and ART population-based issues, as incorporating extensive data from published sources to account for demographics and behaviors, as well as specific drug effects and resistance mutations. The model generates populations of adults with quarterly interval status throughout a lifespan for a range of factors including HIV testing, condomless sex and risk of HIV acquisition. Parameters tracked in the individuals modeled for acquiring HIV include viral load, CD4 cell count, occurrence of WHO stage 3 and 4 HIV disease condition, clinic attendance and dropout, use of specific antiretroviral drugs, presence of specific resistance mutations, adherence to ART and toxic effects of particular regimens of ART. Among the assumptions incorporated into the model for this application were that dolutegravir would exhibit a similar rate of resistance to that of the protease inhibitor, atazanavir, Rayataz, Bristol-Myers Squibb, boosted with ritonavir, Norvir, AbbVie. The investigators inferred this would be approximately 27 times lower than the resistance rate for efavirenz. Management of HIV/AIDS, dolutegravir. AIDS. Read full story more.